Protecting your dog from parasites is one of the most important things you can do to help ensure long-term health for your pet. And heartworm disease is one of the most deadly threats your dog can face. Heartworm disease is a serious problem. The American Heartworm Society estimates that over 1 million dogs currently have this potentially fatal disease, and more cases are being diagnosed each year, many in parts of the country that are not normally known as hotbeds of heartworm. So let's take a closer look at the heartworm life cycle. Heartworms are spread to dogs through the bite of an infected mosquito. Immature or juvenile heartworms, called larvae, enter the dog's body at the site of the mosquito bite. They then pass through dog's tissue, enter the bloodstream, and make their way to the heart. Once in the vessels near the heart, the larvae gradually develop into adult heartworms. The adult worms will cause the dog serious health problems. In severe infections, the worms can disrupt the heart function and blood flow, and can even damage the dog's lungs, liver, and kidneys. If left untreated, heartworm disease can be fatal. As adult heartworms reproduce, they send more newborn heartworms into the bloodstream. At that point, if the infected dog is bitten by a mosquito, the disease may then be spread to other dogs. The time between the initial mosquito bite and a positive test result for heartworm disease is often more than 6 months. So unless you are continuously administering a monthly heartworm preventative, your dog can test negative, yet still develop heartworm disease. Heartworm disease often doesn't present with many symptoms, so it can be very difficult for pet owners to spot. When symptoms do appear in your dog, they can include coughing, fatigue, and exercise intolerance. Unfortunately, by the time these symptoms appear, it's usually a sign that significant damage has occurred. So what can you do to protect your dog? You can take steps to reduce your dog's exposure to mosquitoes by eliminating standing water where mosquitoes breed. Cleaning gutters, emptying bird baths, and outdoor pet bowls will all help a little. But it's hard to eliminate mosquitoes. They can survive extreme temperatures and reappear when you least expect it. Fortunately, it's easy to prevent heartworm disease. Simply have your veterinarian test your dog annually and give heartworm prevention each month all year round. Preventatives don't kill adult heartworms, they kill the juvenile heartworms before they can grow and reproduce. That's why it's important that your veterinarian tests your dog for heartworms before starting a monthly preventative routine. A positive test result may be an indication that your dog requires more aggressive treatment. And serious health issues can occur in dogs with a pre-existing heartworm infection if they begin a heartworm preventative routine. So follow your veterinarian's advice and have your dog tested for heartworms regularly. To avoid the deadly effects of heartworm disease, your best bet is to start a monthly heartworm routine as soon as you can and stick to it. Dealing with fleas is a very common and annoying problem for pet owners. Chances are your dog will encounter these thirsty little bloodsuckers at some point. These tiny pests can be hard to spot. Fleas can't fly, but they can jump up to 8 inches high, making your dog an easy target. And they can be more than just annoying, they can pose a serious danger to the health and well-being of your pets and family. The saliva from flea bites can trigger an extremely unpleasant skin allergy in your dog. Severe flea infestations can produce blood disorders, especially in puppies or older dogs with other health conditions, and ingested fleas can even cause intestinal tapeworm infections. So let's take a closer look at the flea life cycle. Fleas live off the blood of their host, whether that's your dog, your cat, or a wild animal. Once a flea jumps onto your dog, it only needs a few seconds to begin feasting. Fleas must feed a lot in order to reproduce. A female flea consumes 15 times her body weight in blood every day. Once she's made a meal of your dog, she'll start laying eggs in less than 48 hours. Female fleas produce 40 to 50 eggs a day, and they usually lay their eggs right in your dog's hair. Many of these eggs will fall off your dog, spreading the infestation all over your home and yard. Flea larvae, which are similar to maggots, hatch in just 1 to 6 days. At this stage, they like to live deep in carpeting or under furniture. Outside, they develop best in shaded areas or in yard debris. The larvae build a cocoon to help them grow and mature into adults. The adult flea can emerge from the cocoon in just 13 days. However, a fully developed flea can remain inside the cocoon for nearly a year, which is why infestations can sometimes pop up out of nowhere. Once out of the cocoon, adult fleas begin searching for their next meal, and the whole itchy cycle begins again. Most people don't realize that in many areas, adult fleas can survive throughout the winter on pets and wildlife, so the threat never truly goes away. If your dog is showing signs of excessive scratching, check his skin and coat for the presence of adult fleas. Using a fine-tooth comb can help, and also look for signs of flea dirt, the dried blood and waste left behind after a flea feasts on your dog. If you find evidence of fleas on your dog, it's important to take action right away. Fleas reproduce so quickly, you'll want to fight back before the infestation has a chance to grow. There are many different types of flea treatment options available. Talk to your veterinarian about which one is right for your dog. If your home is already infested, you can help eliminate flea eggs and larvae by steam cleaning your carpets and upholstery, washing all bedding weekly, and using flea sprays as recommended by your veterinarian. If you have other pets at home, ask your veterinarian to recommend an approved flea product. The best way to fight fleas is to kill them before they can reproduce. So talk to your veterinarian about how a monthly parasite protection routine can help keep fleas off your dog all year round. Dogs have a nose for adventure, but sometimes they can get into trouble without even knowing it. Intestinal parasites, or worms as most people call them, are a common and widespread danger to your pet. It's important to distinguish intestinal worms from heartworms. They are two completely different things, and dogs get them in very different ways. Here, we're talking about intestinal worms that infect your dog's digestive system. Dogs get intestinal parasites in one of four ways: by ingesting worm eggs or worm larvae in feces or infected soil, ingesting raw meat or remains of an animal that has been infected, by becoming infected by worm larvae puncturing the skin, as is the case with hookworm infection, or directly from their mothers, either while she is still pregnant or through her milk. The larvae migrate throughout your dog's body before attaching themselves to the intestinal tract, where they grow into adult worms that feed off your pet and cause significant health issues. Dogs with intestinal parasites can suffer from diarrhea, dehydration, blood disorders, inflammation of the large intestine, and coughing. Worms can cause weight loss in adult dogs and failure to thrive in puppies. In severe cases, intestinal parasites can be fatal. Some of the most common intestinal parasites are roundworms, hookworms, and whipworms. Let's take a closer look at the life cycles of these three dangerous parasites. Roundworm eggs can be found in dog feces, infected animals, and animal remains. The eggs can remain in the yard even after the initial source has disappeared. Dogs ingest the infected eggs. After hatching, the immature worms usually pass through the dog's liver and lungs and settle into the dog's intestines, where they mature into adults. From there, adult roundworms lay more eggs, which are passed through the dog's feces back into the environment. Dogs can get hookworms through animal feces, small infected animals and insects, or when hookworm larvae penetrate the dog's skin. When a dog becomes infected, the larvae move to the small intestine, where they mature into adults. Sometimes they move into the lungs or skeletal muscles, where they remain dormant until migrating through the intestinal tract. Hookworms can live up to 2 years, feeding off your dog's blood and the walls of his intestines. Finally, dogs get whipworms by ingesting the worm larvae present in the environment. Whipworm eggs can remain viable in the soil for many years. Once inside the intestines, the worms take approximately 3 months to mature into adults. Once this occurs, adult whipworms live in the dog's large intestines and only shed eggs intermittently. However, female whipworms can produce up to 2,000 eggs each day. So how do you know if your dog has worms? Your veterinarian will test your dog's stool for worm eggs at his yearly checkup. Other signs to watch for include coughing, vomiting, diarrhea, especially if there's signs of blood, worms in his stool, lethargy, an appearance of a pot belly, weight loss, dull coat, or scooting his bottom across the floor. Only veterinary tests for intestinal parasites can provide an accurate diagnosis. So be sure to visit your veterinarian if you suspect your dog may have contracted worms. To reduce the risk of your dog or family coming in contact with worm eggs and larvae, pick up feces immediately when walking your dog and clean your yard often. And follow the Companion Animal Parasite Council's guidelines for fecal testing. Worms are a continuous threat, so ask your veterinarian about effective treatments that can help protect your dog from intestinal parasites all year round. Just one dose a month can make a big difference in the health and well-being of your pet. Ask about Trifexis, the combination product that kills fleas and prevents infestations, prevents heartworm disease, and treats and controls hookworm, roundworm, and whipworm infections. See the full product label for complete safety information. Serious adverse reactions have been reported following concomitant extra-label use of ivermectin with spinosad alone, one of the components of Trifexis. Treatment with fewer than 3 monthly doses after the last exposure to mosquitoes may not provide complete heartworm prevention. Prior to administration of Trifexis, dogs should be tested for existing heartworm infection. Used with caution in dogs with pre-existing epilepsy. The most common adverse reactions reported are vomiting, depression, itching, and decreased appetite. To ensure heartworm prevention, observe your dog for 1 hour after administration. If vomiting occurs within an hour of administration, redose.